There's been a lot of exciting data that I'm going to be presenting at this conference with regards to radiation in both in renal cell carcinoma, both the primary setting as well as the metastatic setting. We're learning a lot with our modern technology. We're able to target primary RCC tumors more effectively, and we're able to treat them more effectively. There's actually some really exciting data that was presented at ASTRO in 2023 from the FASTRACK II trial, looking at primary RCC tumors targeted with stereotactic body radiation therapy or stereotactic ablative radiation, ablative body radiation therapy, so also known as SABR or SBRT. And so what we've learned from that is that that trial had 70 patients. They were all non-operable at this time, and we found that there was excellent local control, excellent efficacy in terms of distant metastases, and then also with very low toxicity. It was very well tolerated, and so I think that that sets the stage for the next set of questions that we need to answer. Which is what about inoperable patients? How are we thinking about the tools that we have available for treating primary RCC? Of course, there's surgery, there's ablative techniques, and then where does radiation fit in? So I think we're really looking forward to a lot of that exciting data. And then in the metastatic setting, specifically oligometastatic RCC, there's a lot of really exciting data that's come out demonstrating that we can effectively target oligometastatic sites, and we may be able to delay the switch of a very otherwise successful systemic therapy in patients that have metastatic RCC. So essentially, if you target, like, let's say the medication, the systemic therapy is working very effectively, and there's one or two progressing sites, but otherwise it's working very, very well. So if you just target those two progressing sites with radiation therapy, we can delay the need to switch to a different systemic therapy. Along the same vein, we also have learned that we can even maybe defer the initiation of systemic therapy altogether, so trying to keep patients off of systemic therapy by targeting the progressing lesions that are throughout the body. That's also very exciting. And then finally, we're understanding how to combine radiation therapy with immune checkpoint inhibitors, because there's a lot of data kind of suggesting that they work synergistically. I will be highlighting the rapport trial throughout my talk, which basically showed that there was a benefit to combining radiation therapy and immune checkpoint inhibitors. There's a question about sequencing and timing of doing that, but it was also, we'll talk about the results from that, but it was very, very exciting. So I think there's a lot of areas where radiation can play a major role for renal cell carcinoma and for our patients.